The environmental toll of the conflict is reaching catastrophic levels. In the country, there were damaged factories, leaking chemicals, and collapsing public services.
Our factory was hit and we lost control of stored materials. RSF burnt large parts of it and we were worried about leaks, but there was no access for repairs and no authorities to manage the site safely.
In Khartoum, key industrial and energy sites have been hit hard. Many stand broken and abandoned. Some still storing hazardous materials. Their proximity to residential areas means pollution is spreading directly into communities already struggling to survive.
The capital was occupied by the RSF militia for 2 years. Health facilities were occupied as well. It became a breeding environment for diseases, and this prevented any efforts to defeat the pandemics as the state was a war zone, and even medical staff were targeted and killed, and ambulances were looted.
Explosive weapons have shredded buildings that contain materials like asbestos, a known cause of chronic respiratory illness. With little capacity to clear debris, families remain exposed to hazardous dust every day. The destruction of sanitation and water plants has left waste treatment systems non-functional. Solid waste now piles up in open areas and drains into the Nile, posing a grave risk of disease outbreaks.
I got sick a few days after returning home. I have dengue fever and typhoid. Most of my family members are sick. The pollution is everywhere.
Residents living near industrial areas say the pollution is now part of daily life, and contaminated water is a breeding ground for diseases like malaria, cholera, and typhoid. Health workers call for an urgent intervention, warning that Sudan could face long-term environmental damage that may take years or even decades to reverse. As the conflict in Sudan continues, the environmental fallout is growing, largely unmonitored and untreated. Its consequences may outlast the war itself. Naba Muhiddin, CGTN, Port Sudan.